We put up a slide that was slightly controversial, and partly because I wanted to talk as much about the end product that you get at the back, but all the stuff that's in the middle. Because if you put all the stuff in the middle right, you should get a good quality product at the end. So it's not just about the specificity of the product at the end. And this is a data-led talk, so there's people on the right are all the people that have done some fantastic work leading into a load of data, a load of slides that's in this talk. So thank you to them. So, obviously, if I don't put something in for the sales team, they will shoot me when I go home. So we like antibodies. We've been doing antibodies for a long time. We've got lots of antibodies, multiclonals, chimeras, conjugations, carrier-frees, as well as what we would call parents, the naked parent antibodies, the original versions of them. But the one I'm going to focus on is one of the far left in this case is the knockout validated antibodies. Right, so we've been doing knockout validation for a long time, thanks to Alejandra, and we do it, I have no shame in saying, we do it mostly in Western blot. If you don't like Western blots, leave the room, because there's going to be lots of Western blots, sorry. And you see it's a really nice example of a wild type and a knockout in there for P53. Where we need to, we'll put in data for IHC. We'll do ICC, we'll do flow cytometry, whatever is required, therefore, for the customer and for what the needs of the target happen to be. And the last time I checked, which was last week, on the website were 5,128 knockout validated primary antibodies. So that's good. So we've been doing it for a long time, but of course the key component into this is the cell line. Right, well I'll get to that in a minute. So this is our general workflow for antibodies. Start with what we want to do, so make a product. What do we want to make it to? What is the application you want to put it into? Screen it. As you know, all our recombinant or rabbit monoclonal antibodies are recombinant converted. We'll do application screening as soon as we can, try and make sure we're pulling out the right antibody to the right application. Do biophysical QC, which I'll come back to, final QC, launch a product, and then enhanced validation. And partly, the title says, the quality of the materials is just as important as the quality of the test. Why is that important? Because if you chuck in low quality immunogens, if you use overexpression cell lines, you use over or under fixed tissues, and those are just a few examples, there's a ton more that I could throw up, you're not going to get the quality antibody coming out of the back end. So you've got to fix that in the first place. So we use in-house immunogens. We make all of our own proteins. We will use primary cells where we can. Obviously, not all targets you're able to do that, but you'll do it wherever we can. And we make sure that we're getting high-quality tissue providers in our IHC and make sure that's embedded into our culture and in what we do, so that we get a good quality antibody. And underpinning all of this, where we can, is knockout validation. And that's knockout validation at the earliest stages in application screening. Sometimes that's not always feasible. So it may well be a final QC. It may well be at the final stage, antibody has already left the building, and we subsequently knockout validate it. And of course, in all the circumstances, as it was highlighted the other day, if we subsequently find or knockout validate an antibody that's already on the catalogue and we find it fails, then we will take it away. And we'll inform you that we are taking away and apologise, because that's what we do. That's what we should be doing. I want to add to anybody else who's in the audience, complain. I wanted to ask this talk, just make sure you complain. I can't get across all the thousands of antibodies that are there at all times. So if you've got a complaint, and I have a team that will go and look at that complaint and validate it, and if it's wrong, and if we agree, then it will go away. We've removed a hell of a lot of antibodies because you complain. But don't just sit there with your data going, oh, well, Abcam went and validated this antibody, it doesn't work. Tell me about it, and we'll go and do something. And hopefully speak for all the rest of the people in all the rest of the organizations to say the same thing. So we've been doing this for a while. Of course, the raw material for this is the cell line. And so we've been working with cell line providers for some time. And when we do this, we buy them in as genomically validated cell lines from multiple different suppliers. And then we proteomic test them. Now, full transparency here, this is proteomic validation with an antibody. So you have this circular argument of antibody validating the cell line is validating the antibody. We'll get there. But if you're trying to determine and use a high quality, you think is a high quality antibody, it's well published in the literature, it's been knockout validated in a completely different cell line, all these things we bring in to try and use that antibody in for the cell line, and we use these, we find failures. So we get a number that passes, it's great. We get a large number of failures, most of those for no expression in the wild type. As well as some truncation and insertions, and we get what we term inconclusives, which is that we can't actually determine that it truly is a failure. We just don't know. So sometimes there's no antibodies to confirm it, sometimes the antibodies aren't very good. A couple of examples coming up. So this is a really nice antibody, it's very clear. I hope it's clear. Wild type with a knockout, positive, negative, cell lines on the side, and that one's nice little tick. This one is one that didn't work. But clearly there's still a band of the knockout on this Western blot. And then the really messy one, which nobody ever shows, but I'm going to show you, where you just don't know. The quality of the antibody is not good enough for this particular antibody. We can't determine for the cell line whether this is a knockout or not. It should be sitting around 50 kilodaltons. So you've got to call it as an inconclusive and deal with that. And we've been, because of the quality that we've been able to get through from other people, we've been developing our own internal high-throughput cell engineering pipeline, delivering proteomically knocked out validated cells in 3 to 4 months. And you can see at that bottom graph the way that it's been ramping up. We've been doing this and working this up for many years. And you see how we work our way through generating these cell lines. And importantly, is the end stage of that is that proteomic validation. And you can buy them on the website. There's a QR code at the end. You can link to it, just search cell lines. And we have custom if you really want to. And we're at the stage of doing about 100 a month. But I'm not going to lie to you and tell you I've fixed it. I'm not going to say, by the way, we've done all internal work and they all pass. No, they don't. They also fail. They also have inconclusives, and some of them pass. It's the nature of the beast. It's a difficult thing to do. So you've got to test it. And as we've just shown, that testing it with a Western blot is a little bit difficult. So we've also been working very closely with an external company to do mass spec. So they will take the wild types. We've analyzed all the wild types. We know roughly where we think we're going to be able to use mass spec and the number of peptides that are required in order to give us confidence that we have a knockout or not have a knockout. So we can actively understand what we're going to send for a mass spec and work with the company to do that. And so the first test of that is that mass spec can verify our Western blot results. So here's an example of a lovely Western blot on the left. Yeah. And on the right is the mass spec. Now, what you can see here is the wild type's in green, the knockout is in purple, you can't see any purple. And just for those doubters in the audience, we've also got our graphic down the bottom which demonstrates we did load something in for the knockout, so it's not like we forgot it. It does exist. And that's great, but that's not the purpose. The purpose isn't to verify the Western blot. We're not always doing them side by side. The purpose is to send them off for knockout verification first without doing this. Started doing the Western blot. And I'm sorry to be the spoiler here, but it's not the panacea for knockout verification of cell lines. So we get good ones. That's a nice positive. That gets the green tick. There's a negative. In this example, again, we know we loaded it. We can see that we've got multiple peptides in this knockout. Therefore, it has not worked. And we get, guess what? Inconclusives. Some that really shouldn't do that. It's meant to be translating this way. Knockout, look, the wild type looks good. We've got loads of peptides. We know we've got confidence over it, and we've got something going on here. It's not a truncation, so it's not like we've got lots of things going on here. We've just got one little band in there. One peptide that seems to have popped up, and we're working with the company to understand more about exactly what that is. But we still get, inconclusives. We still get passes, we still get fails, we get inconclusives. And I'm sharing this stuff because I want you to understand that it's not easy. And that if you're going to buy in cell lines that genomically validated, you're going to get this result. And so be prepared for it, because you have to test it and make sure you got that right. Because you're going to have to understand that you've got a proteomically validated cell line before you then apply it into your antibody cascade, which is what we're doing. And we've got to get it right. And sometimes it's a really hard job. And what you end up with is an antibody that has got the quality in the middle, and it's a good quality antibody that comes out the back end. And so I'll switch gears into quality in terms of antibodies. And this comes back to some of the comments we've had earlier about knowing what the thing is. What is in the tube? Do we know what is in the tube? Actually know what's in the tube. And we've been working on biophysically QCing our antibody, our rabbit monoclonal antibody portfolio. We are at 97%. Sorry, Alhan, it's not 100% yet. I'm working on it. We're at 97%. It's taken us a while to continue to go. It's only at 12,287 done so far. But they've all got application testing. So we know that they have got all the data to allow us to think or believe they're specific, but this is about what is in the tube. We know, having done this work, that there is one light chain, there's one heavy chain, and we know what the aggregation status is. Because, and I'm sorry to break it to you if you didn't already know this, hybridomas can change over time. They're a living cell line. You know, this was one of ours. This was Cyclin D hybridoma that we had in stock that we would grow and it would produce beautifully, and we'd have some great staining, and then we keep on passaging it, and then it would slowly turn off, and you know the positive staining would go down, the back would come up, and you'd have to subclone it and repassage. We do all that nonsense, and it would take time. And when we converted it and did recombinant conversion on it, the one on the right is exactly the same one single chain, one heavy chain. I didn't put the HPLC trace up, and we reproduce it time and time again, and it makes it better, and we know exactly what is in the tube. And clearly it works. Now, I wanted to highlight to all the other people in the audience, all the other competitors in the audience, this is not a slide to diss competitors. So this is about making sure that your quality is in there. And when your quality is in there, this is an aggregated analysis, thanks to Isabella for doing this from all the Icaros results, is that you get that performance. You're able to show that you're getting very good knockout results. You're getting good results, IP, Western blot, and ICC for Icaros. Thank you guys for doing all this work. Quality is in there, and when you do it right, you get a good quality antibody, and the literature is saved. And we all do it the right way. And everybody in this audience is trying to do that. All the people and competitors in here are trying to do that. Thank you to all of you for doing the best possible job that we can. And that's my summary. So the little QR code at the top. I challenge you, while Alejandra's going to move me on, I've aggregated a load of different Western blots. Have fun while I'm talking, trying to work out which one's the truncation, which one's the insertion, which one's the fail, and there's some positives in there. But my ending message here is it's not just about the end product, but how you get there. And making sure the quality embedded in your entire process in order to be able to get the best product out at the back end. When you're doing cell lines and you're buying in cell lines, you've got to have them proteomically knockout validated if you're going to put that into your pipeline or you're going to use in your experiment. Otherwise, you're going to fail them and you're going to waste a lot of time. There is no perfect solution. I think we all know that. You've got to mix stuff up. Sometimes you might do Western blots, sometimes do mass spec. You're going to use application validation. You're going to use a positive cell lines. You're going to use a negative cell lines. And thanks to all the comments around phosphomarks being hell, then thank you everybody for commenting on that. That's what you've got to do in order to be able to know that you're getting the right antibody and it works in your assay. And just remember, you've got to know what is in your tube. And I will leave with the other slide, just remind you if you didn't already know, we joined Danaher in 2023, and we're part of a larger, bigger global science community. Thank you.